Hi, I'm Vicki Runk, and here we are on the porch again at Forest, and we just wanted to have a little discussion with two of our key ladies, two people that you'll get to know very well if you become a resident here at Runk Pratt of Forest. Forest is a 75-bed memory care facility with very special folks inside. Folks that we've determined need Alzheimer's care and dementia care, which is a specialized unit that we train our girls specially in. Our key staff have to have a very good understanding of what that means as they lead their team inside. So we stay in very close contact with these two individuals, and we make sure that they are right in tune with what we need to be doing with Alzheimer's care. The first person that I want to focus on today, we have Pam and we have Nancy. It's Nancy Ayers. Nancy is new to our program, and I just want to talk with you a little bit, Nancy, about what you've done in the past to kind of prepare you for this journey that you're on with Runk Pratt right now. This is something I don't think you really thought you'd be doing as you looked into the future. And talk to me a little bit about what you've done in the past that you feel like God specifically called you to this job.
Well, I'm a registered nurse of 25 years with a lot of various experience. I've been a nurse in the emergency room. I've worked with skilled care. I've been an LPN instructor for a local LPN program. I have worked with hospice. And I feel that having all this experience is going to make me be a better professional in taking care of our residents here at Runk Pratt. I feel that I have excellent assessment skills, of which I think is very important with dementia and Alzheimer's patients. They can't tell us what's wrong. They can't tell us they're in pain. They can't be specific about a problem that they're having with their health. So I feel that being an RN and with all my experience that I'll do well with taking care of these residents here at Runk Pratt.
So as I hear you talk, and we talked about this earlier, you know, you've been used to that critical care, or when something happens, you know exactly what to do. And that becomes important to us too with our families, doesn't it? Just giving them that peace of mind. Talk to me about, you know, where you see this program going in the future and really what you're trying to develop inside, even the short time you've been here. What are your goals for the nursing department here with the memory care folks?
Well, I think basically having continuity of care, everybody taking care of all the residents in the same manner. I think that it's very important that professionals have good assessment skills, that they're able to recognize a problem and to feel comfortable coming to me with that problem. I think that we do a great job here with involving our families, seeing that they are here with physician appointments with Dr. Peter Betts that comes in usually monthly, and Dr. Gazan who comes every week to see our residents with any kind of acute illness or routine visits.
And tell our viewers a little bit about Dr. Betts and Dr. Gazan and what that brings to the residents and their families here.
Well, Dr. Betts, of course, specializes in geriatric psychiatric issues, especially dementia and Alzheimer's. He's located here in Lynchburg. He usually calls us with a specific group of patients that he sees, and we have those patients ready for him to see when he gets here. We also involve the families. We call them ahead of time and let them know what time he's going to be here so they can be here and be a part of the visit as well. Dr. Gazan comes every week. Of course, he's our medical director, and he comes every week to see patients that are acutely ill or have medical issues that need to be addressed.
So with all that being said, we're pretty transparent with what we do here, aren't we? We really involve the family so that they know every twist and turn that's being taken with their family member.
We do. Any kind of change in medication, treatment, and change in their condition, we're making them aware of it. We're phoning the patient's family, letting them know what's going on. We have no visiting hours here. Everyone can come in at any time. We have residents, families that spend the night. We're not closed door, we're open 24/7.
And what have you been able to see as far as, you know, our girls, our CNAs that work with this particular population here at Forest? I mean, what's one of the things that just really stands out with the group that we have here now?
They're in tune to the residents. They know their every move. They know their pattern of sleeping and eating, their transferring situations as far as what it is to make them safe in this environment. Basically, continuity of care is key when you're taking care of Alzheimer's patients. So basically what we do is try to keep that particular CNA with that particular group of patients at all times.
And that's something you oversee personally?
Yes, ma'am.
And we also have other nurses on staff and on duty as well. Every other weekend we have another LPN, and we're looking at putting an LPN on second shift now. So always adding to making that program stronger and better is what we're trying to achieve, wouldn't you say?
Absolutely.
Thank you, Nancy.
Thank you.
Well, as you can see, we really are focused on care inside Forest, and that's something that's near and dear to my heart. I said a long time ago that I would never do memory care till I could do it right, and back in the year of 2000, God gave us Forest, and it's been an evolving mission for us, and I'm truly blessed to have these two ladies leading the team now. Now I want to focus on Miss Pam Turpin, who has been one of my greatest joys over the last couple months, just getting to know her and hear her passion. And I haven't met a lot of people that is as passionate about what she does, and it's exciting. It's almost like infectious, don't you think, when you get around her? She's just one of those people that you want to follow and you want to do more for. And so I'm appreciative of Pam today. Pam, tell our viewers a little bit about same kind of thing. Where did you come from? What led you to Runk Pratt? And then talk to me just a little bit about how you feel like all of those things are going to be able to do what you need to do here for this team.
Sure. First of all, I want to say thank you for letting me come here to work for you and Brian. I've got 22 years in the healthcare industry, and this facility is top notch. No doubt about it. I have seen lots of facilities over the years. I've never seen the owners so actively involved as you and Brian are, and it's a privilege and honor to work here. 22 years in the healthcare industry with the VRS. I could have retired in a couple of years, and
I think I tried to talk you into it.
You did. I think you did. And so I decided to come here, and this is where I need to be. This is where I want to be.
You told me this is where your heart is.
It's always been where my heart. This is where I've always wanted to be, and I've actually thought about this for a whole year. This is not something overnight that I wanted to do. This is something I've been thinking about for a while, to come to Runk Pratt, and this was the only facility that I wanted to come to. There were many more facilities to choose from, but this was the only one that I knew that I needed to be at, because you all care about the residents, the families, the staff, and that I wanted to be a part of that.
And we equip you with what you need to do your mission here.
Absolutely. Tools for success. That's what you've given me, tools for success. One of them is Nancy Ayers.
I totally agree.
Yes.
What kind of things do you feel like that you want to see happen underneath the new leadership here with what you have as goals for our families and for our residents? What do you see going forward will be some of the major changes here?
Well, I don't know if it'd be changes, but just encouraging more family participation. We have lots of family they're actively involved in all of their families' lives, and I want to continue that. I want them to feel comfortable coming in here. I mean, I'm here probably 12, 13 hours a day just because, not that I really need to be, but because I want to be. And the families come in, I want them to come in and be able to come in my office. It's an open door. I want them to be able to come in and talk to me and tell me their concerns, because I'm going to take care of it.
That's right.
I'm not going to let it wait overnight. I'll take care of it then, and the families appreciate that. I give them my personal cell number. They call me at home at night. Hey, Pam, I just want to know. Okay, I'm going to get you that answer. I don't want them to wait. They've already been through so much pain with their family members with this disease, and I want them to be able to get their answers right then.
Well, as you can see, we're sitting on the front porch here, and we kind of feel like we're at our house, just sitting here chatting. But one of the things me and Nancy and Pam were just talking about is the fact that this door is so easily accessed, and we open the door to our families, and we want them to come in and be involved. And what we want to do to you today is just encourage you. I wanted you to just get to meet these great ladies. We kind of kept them hidden for the last couple of months, and I wanted you to get to see what we see. And we're extremely so fortunate to have them both. And we want you to, if you have anybody that needs memory care, any kind of need in that area, I want you to feel free to call Pam. Just like she said, she's available. She'll answer any of your questions. And we consider this a journey that we're on with our families. And I've said before, and I feel it to be true, that I think a lot of our time is spent with families and education and making them feel comfortable, and that we want to be seen as taking their hands and walking that journey with them. As I said a couple weeks ago, Alzheimer's is the 6th leading cause of death in this nation. And as the baby boomers come on board, it's even going to be more of a drastic need for what we're doing right here inside of Forest. We need your help, and we need for you to contribute to the memory walk, We're getting ready to do another Friday donut day, and we're getting ready to welcome you guys in. We need about 50 more donations to meet our goals. And we can't cure Alzheimer's overnight, but we can certainly make a difference. And so I appreciate you guys sitting on the porch with me today and taking this time to chat with me. Until next time, I'm Vicki Runk.